Many Aboriginal youth face the same challenges in their daily lives: broken homes, abuse, poverty, low education, isolation, and discrimination. And many of them have nowhere to go and no one to turn to. In this situation, how would you cope? For some, alcohol may seem like the only answer. Alcohol abuse in Aboriginal youth affects individuals, families, and communities. As nursing students, we want to help you overcome the challenges that might draw you to alcohol by giving you the power to make good decisions. The decisions you make now will impact your future in ways that you may not realize. The younger you start drinking, the more severe the consequences. Ever been curious about alcohol or tried it yourself? The average age that the general population has used alcohol for the first time is 16 years old. But the average age that Aboriginal youth have tried alcohol for the first time is 12 years old. And 91.9% of Aboriginal youth in grades 9 to 12 binge drink or drink 5 or more drinks on one occasion. Alcohol use before 14 years of age is associated with increased risk of future and ongoing alcohol problems. Every drink you take brings you closer to injury, violence, alcohol poisoning, and death. You may start drinking to feel accepted by your friends, to help you cope, or to make you feel good. But you might not realize the harms that alcohol can do to your body. A young person's brain is not fully developed until age 20. This makes it all the more vulnerable to alcohol's harmful effects. Drinking too much alcohol at one time can negatively affect your memory, problem-solving skills, concentration, and attention span. Years of heavy drinking may result in brain damage, liver disease, cancer, or heart disease. You might think that none of these things might happen to you now, but the consequences of alcohol do not discriminate. Take, for example, Gary, who started drinking at 13 years old. In one sitting, he can drink 3 bottles of vodka and lager. Gary died at 22 from liver failure, never thinking that this would happen to him. Along with the physical harms of alcohol abuse, the psychological harms can be just as devastating. You may start to drink because you feel depressed, anxious, and vulnerable. You hope to forget, to escape, to suppress your emotions, to ease your anxiety, and to numb the pain. But alcohol is not the solution. The psychological effects of alcohol abuse can lead to depression, anxiety, isolation, low self-esteem, violence, aggression, obsession, and suicide. Aside from psychological harm, alcohol abuse can negatively impact your social behavior and relationships. It can change the way you think, and it can also change you. It can bring out aggression, mood swings, and anger. It can place a strain on relationships with others and the community. Abusing alcohol can make you do dangerous things you would not usually do. For example, driving under the influence, having unsafe sex, and performing acts of violence. These risky behaviors can lead to serious injuries, criminal offense, and even death. With all the physical, psychological, and social consequences of alcohol abuse, why is it still hard to say no? There might be a fear of ruining a relationship and losing a friend. Maybe you want to feel accepted, or you might be bullied or pressured into doing something you don't want to do. Saying no may not always be easy, but there are ways to avoid alcohol abuse. You can politely refuse by giving reasons and talking about what's important to you. You can also avoid places that would make you vulnerable. Surround yourself with people that are less likely to abuse alcohol. Spend time in places where you're less likely to encounter alcohol abuse. Find something productive to do, like joining a sports team or taking up a new hobby. Now that you know the harmful effects of alcohol abuse, use your knowledge to make smart decisions. You might not feel that asking for help is an option. When you did ask for help, others might have treated you unfairly, disrespecting your culture, values, and beliefs. You might have had difficulty accessing and receiving appropriate care. Or maybe they simply didn't understand you. There are several programs that are sensitive to Aboriginal culture, beliefs, and practices. You can call the BC Crisis Helpline at 310-6789. They operate 24 hours a day and will connect you without wait or busy signal to an Aboriginal mental health liaison worker who is trained in mental health referrals. The United Native Youth Association is located in Metro Vancouver. They empower Aboriginal youth through their programs, which includes education and training, personal support, live-in programs, and sports and recreation. Their main goal is to provide opportunities for Aboriginal youth that will help them reach their full potential and personal goals. You can also visit the Youth in BC and Here to Help website. Youth in BC is an online crisis chat service with a trained volunteer from the Vancouver Crisis Centre. Here to Help is a website with up-to-date information, publications, and stories on mental health and substance use, as well as resources like life skills and other coping-related toolkits, plus a discussion forum where you can connect with others. Thank you for watching our presentation. And remember, you can make a difference, be the change, and break the cycle of alcohol abuse.